Hi, I'm Dr. Tony Prochazka. Today I'd like to talk to you a little bit about neck lifting. Now, the neck is actually really a continuous structure with the face, and the only thing that divides the two of them up is this ridge of the jawbone. And there is a very important structural muscle in the neck that really holds it up and holds it into position, and that is a muscle called the platysma. I can actually demonstrate that muscle to you now very easily. Not sure whether you can see it, but these bands here, and it goes out to about there. It's actually a paired muscle, so it goes a bit like this, and in the midline sometimes some of the muscle fibers are absent. And what can happen over the time is that the platysma can actually separate out more and more. This can sometimes be hereditary, and so a lot of the support is lost in the midline. And then if you've also gained a little bit of weight during your life and you've ended up with a bit of extra fat here, you get the classic so-called turkey gobbler. But even without the fat, you can still get sagging in the midline here due to that loss of structural support. So one way of improving that is to actually tighten the platysma muscle in the midline through a very small incision behind the chin. This, we will call it central neck tuck. Actually, the technical name for it is platysma plication. Plication is a word just meaning sewing up, basically. Platysma plication is one very important weapon in our armamentarium for rejuvenating the neck. However, I find that very often a better way, or at least a complementary way, to get rid of this excess tissue is to develop it upwards. And this is very effectively done with the max lift, which is the facelift that I talked about previously. The max lift, to be completely accurate, is actually a lift of the lower 2/3 of the face and the upper neck. It's usually just referred to as a facelift, but really it is a face and neck lift. For patients with a slightly more severe problem, we can actually combine the two procedures into one, and we can do a max lift and a platysma plication at the same procedure. And this is often the single most effective way to address this problem of central neck sagging. Now, we're talking about neck lift at the moment. What about patients who also have excess fat in their neck? In this situation, there's a very simple approach here. We can do a liposuction. And neck liposuction is fairly different from body liposuction in that the amount of fat that we can get out is usually much smaller. Very often we can only get a few mils out. I think the most I've ever taken is about 30 mils out of a patient's neck, and sometimes it's as little as 5 or 6 mils. The incredible thing though is that that can make a big visual difference. That tiny amount of fat just removed from the neck can make a big impact visually. There is another advantage to doing liposuction in the neck, and that is that by deliberately creating a little bit of slight irritation in the undersurface of the skin during the procedure, simply by using a cannula technique, we can actually get skin retraction. Now, human skin is very elastic. Some of the elasticity is lost during age, but not all of it. And so we will always get a little bit of snapback. If we can actually create a little bit of irritation and a slight inflammatory response, we often find that that snapback of the skin actually is greatly improved. So not only is liposuction to the neck useful for getting rid of the excess fat, but it can also create skin retraction. And the other good news is that it can be very simply combined with other face and neck procedures, such as max lift and central neck tuck, or platysma plication as it's also known. Liposuction to the neck, by the way, is very safe, incredibly safe actually, because most of the important structures of the face and neck are actually located at the sides.
When we do a central liposuction here, there's really very little that can be damaged. Of course, we still have to take care, but it's generally a very safe procedure, and it's one that I have no hesitation in recommending to patients who I think will benefit from it.